Call this meeting I'm gonna ask, Mr. Bursby would lead us in Ware.
Yes, Father, in the name of Jesus, Lord, we thank you for this day that you have made. We will rejoice and be glad in it. We thank you, O God, for life, health, and strength. We pray, God, you bless us as we go into the deliberation of this meeting. We ask for your divine guidance. Give us the right thing to say, the right thoughts to have. And Father, we pray, God, you continue to bless each and every one here today, each and every family that's represented. And we pray, God, you will continue to bless this nation, continue to bless our city and county. In Jesus' name, amen.
Yeah, let's say this. Pledge allegiance to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This is a call meeting for our county insurance. Presentation of the Ware County Health Insurance Renewal Policy. BCBS. Okay, Mr. John Leggett. He's on.
Yep.
If you would.
Yes. Good evening. Thank you for having me. So John Leggett, MSI Benefits here, a benefits group here to go over the upcoming renewal that's effective July 1st and of the county employee benefits, the employee benefits that are offered to the county employees. So everyone should have this presentation that to follow along with here. And I know there's a lot of numbers and things in this. I'll try to just summarize. As you may or may not know, should know, I think that last year the county made the decision to go from what's called a fully insured contract to a self-funded contract. So the county's now self-insured. All that means is that we still have Anthem. Blue Cross Blue Shield is our administrator, so we still use Anthem as the network. We still, they pay the claims for medical and for pharmacy. But the difference now is that the county pays the claims for every individual up to $100,000. When it goes over that $100,000, there's reinsurance that kicks in. It pays any claims above that number. And so that's the self-insured contract that we have in place. As far from a county employee standpoint, or anyone that's covered, you get your Blue Cross ID card, and Anthem Blue Cross is the insurance company. But in reality, the county's paying the claims up to that $100,000, and there's fixed cost premiums that go into that. So I'm going to go through all that. What you're looking at on page 2, realistically, just the number to look at is. You can see the months of July through June over on the left, but if you go all the way over to the right, you'll see it's kind of faint yellow, just under 2.6 million. So that is a total amount paid by the county from the months of July through March. If you notice when you're looking at this chart here, you'll notice the red. The red is that 212,000 total on the number there. That's the amount combined over that 100,000 that's been paid under the reinsurance contract. So you got to the left of that is the total paid of just under 2.8. You would subtract out that 212,000, and that gives us that $2,580,000 number. So that's the number again through the month of March. If you go below that number and you see the 808,000, that is the fixed cost, administrative cost that the county's paid to Anthem to administer and pay the claims over those from the months of July through March. You take those two numbers, you add them together, it's $3,389,000. And so that is the true nut of what the county has spent July through March. And obviously the plan year that we're talking about is July through June, and of course we're just now in May, so there's a lag time there. But so if you look at that number and you go over to the orange box, you're going to see 93.89%. That is the $2,580,000 is 93.89% of what we call the maximum number there. So that gives us an idea. The claims are running a little bit hotter this year, a little bit higher than anticipated. The target number is typically 80%. So you could say they're running about 14% higher than we would have anticipated. And I'm going to talk more about that. when you look at the bullets on the bottom, the main one to focus on, or not the main one, but the one I want to point out is the very last one. It says the paid ratio for February, March is at 72%. The reason I want to point that out is because claims are running better for the most recent months. So I think we're going to see a better trend than what we've been seeing. And I'm also going to talk about COVID on the next slide. So I'll pause for a minute. I know there's a lot here. I tried to just summarize some things. But any questions on this slide too?
Administrative charges are for what?
So that is the fixed premium you pay to Anthem to use their network, for them to pay claims for the stop loss insurance. And the stop loss insurance, again, is that coverage that where they pay anything above $100,000 on any individual. That's all those fees combined and what you're paying.
Plus we pay our own fees.
You pay that stop loss premium and the claims to give you that number just under 3.4 million, which is the yellow box over on the right side, bottom right. So that's the total spend by the county and for both fixed costs and claims from July 2020 through March 2021.
Okay.
So last year the difference in being self-funded and fully insured is if you're self-funded and your claims run great, you benefit from it. If they run high, then you look back and say, well, maybe we should have been fully insured. When you're fully insured, you're paying a premium, and the claim liability doesn't really hit you like it does when you're fully insured. Last year, when we were here doing this renewal, it made all the sense in the world at that time to go to a self-funded contract, and it still does to this day. Based on how the claims have ran, if you were fully insured, if we'd remained fully insured for this year, we'd be looking at upwards of a 30% or higher increase based on what I'm seeing for the rest of the ACCG block.
Talking about administrative fees?
Your total premium, we would have been looking at least north of a 30% increase with Anthem. But the beauty and the benefit of being self-funded is, and that's why I pointed out the most recent 2 months, COVID, I think, has played an impact on our claims, which is why it ran hotter, and we'll talk about that in a minute. I think, obviously, everyone's getting vaccinated. People have already had it. We're starting to see it flatten out, level out a little bit, and that's why I think it's good to see the most recent 2 months running much better, actually better than the target. And so I think when we're looking at the upcoming year, I expect it to be a much better year than what we're seeing now. If you're fully insured and you get hit with let's just say a 30% increase, and then you have a good claim year, well, that means the carrier made money. That's their whole goal. When you're self-funded and you have a good year, that means the county saved money. And so I think that's what we're going to see this year. If you'll look at the next slide, there's one.
Excuse me, before we move off that,
Sure.
John. Okay, and just to piggyback on what Commissioner Tanner was saying there on the administrative charge, so this is all inclusive as far as the administrative costs and the stop loss, I think you were talking about. So it's all, so I guess if you had to kind of like itemize it out, what would be the administrative cost? That's all inclusive.
So I'm actually going to give you the breakdown on the administrative costs, that where we're at now, where it's going to, the per employee per number.
Okay.
Per employee per month number. But I can tell you, just to give you a quick number here. So basically right now the county's paying $233 per employee per month. If you take that number times everyone that's enrolled, which basically you got 266 enrolled for the month of July and so on all the way down to 2,367, that will give you that $808,000. That's the premium that the county paid. If the county were fully insured and we're looking at this, we're looking at a premium of $3,400,000 is what, instead of just an $808,000 premium. So when you're self-funded as we are, you're looking at a much smaller premium, and the big number is the claim. The big number is always going to be the claims. The administrative cost is going to be on average somewhere in the 15% range, whereas the big number is your claim total.
And I guess, and like I said, I was looking, matter of fact, I read it twice, and just to put it in terms the way I could understand it, just like when you say have a car, and you got homeowners insurance, I'm gonna use that for an example, where you could have like a $250 deductible. All right, that's all great, and if you have something happen, then you know you can file a claim, but you can raise your deductible amount up and you'll lower the premium amount.
That's correct.
So it's kind of like a roll of the dice, you know?
That's right.
So I kind of put it in terms the way I could kind of relate
Sure.
to it.
Yeah, this is the aggregate report to kind of give us the, you know, the big picture for the current year.
Okay.
Yeah, there'll be an individual, a couple slides later, we'll look at
Okay.
that and what raising the deductible does. The reason I was wanting to point to the next slide, we reviewed this a couple weeks back, but this is the one slide I wanted to keep in here with a red box around it. So through February of this year, going all the way back from July of last year, the total claims, COVID-related claims, are about $342,000. And so that's a number, you know, when we were dealing with the renewal last year in April, we obviously knew about COVID at that point. We were about a month into it, I think. And so we had no one had any idea what COVID was going to bring upon us. But when we look back and we say, okay, we had $342,000 in claims, and that's collectively, that's between inpatient, outpatient, in an office professional setting, and the ED is emergency department. So all totaling $342,500. If you pull that number out of the total claims, then our loss ratio is about 81, just under 82%, which is a normal expected number. And so we're seeing this not just here, but we're seeing it among all employers, especially with the county governments. That's mostly what we have is government clients, counties and cities. And to put it in perspective, as you know, the county was in the ACCG pool through Anthem, and we pulled out of that last year and went out on a self-funded contract. This year, the pool ran almost at 100%, the highest it's ever ran at. And that's why I said if we had remained fully insured and stayed in that pool based on the increases I've seen, we would have definitely been looking at a 30% increase in the premium. And like I said, that's why I think it's even more important to be self-funded now, because they're saying we're going to raise your rates 30%, whatever. Maybe we get it down to 25% in negotiating or whatever it may be. But the difference is that's money the premium's going up. We know we're going to spend that premium. Whereas you say our claims are going to raise, we'll see what happens. We pay the claims being self-funded. And so really the only thing we have control over is what the fixed cost is going to be. So when we get on the next couple slides, we're going to look at the fixed cost and the claim total. Any questions on this?
Okay.
No. So if you go to slide 4, this is the summary of the two plans that are offered. We have what we refer to as a base and a buy-up. You can see the enrollment on each plan, and we have basically everybody's loaded in the wellness plan. But you can see we have 75 employees with single coverage on the base, 30 with a spouse, 19 with children, and 25 with family. A total of 149 enrolled in that base plan, the green one. And on the buy-up, we got 53 enrolled in the buy-up plan with single coverage, 23 employee and spouse, 8 with children, and 21 with family, for a total of 105. As you recall, last year, the only change we made to the plans, we kept the plans the same, with the exception of we lowered the deductible $1,000, because prior to last year, we had what was referred to as a health reimbursement arrangement, where employees were reimbursed the last $1,000 of their medical deductible. Well, when you're fully insured, an HRA can make sense, but when you go self-funded, the county's paying the claim, so there was no reason to pay a claim and then reimburse the employees. So we lowered that deductible and kept everything else the same. Last year, deductions did not change, and the plans actually improved. And so this year, not recommending any kind of change to the plans, but if you'll notice on the bottom, you have current. The current is the current employee deductions, and then the yellow proposed is what's being proposed for the employee's cost to go up. So this would be a slight increase this year being recommended. So for instance, employee on the base plan was paying $32.94 a paycheck, would go up to $39.53, and that's an increase bi-weekly of about $6.59, and so on across the board. If you take all of the employees that are enrolled, you got 254, and you total up all their deductions over the course of the year. Right now, the county's collecting about $584,000 annually for the enrollment. And what that would do is take that number to just over 700,000. Does that make sense? Any questions on that?
Okay, that's what they increase for each employee, right?
Correct. That's what it would look like there.
And this is a bi-weekly deduction?
It is.
So they're actually paying like $79, somewhere around in there?
Oh, per month?
Yeah, per month.
Right around there. Correct.
That's just with single, right?
For single. Mm-hmm. It does come out pre-tax because the county has a Section 125 cafeteria plan. So, $40 deduction, $40 biweekly deduction. You call it, say it's 20 a week. It's going to feel about like $15 a week out of their take-home pay. That's what it would amount to, somewhere in the neighborhood, depending on taxes, because they take it out before they pay taxes on it.
So this increase, I'm gonna make sure I understand this, like on a single employee under the base plan would increase about $659 every week, every other week, I mean?
Every other week. Mm-hmm.
Right, so around about, what, $14, $15?
A month.
A month, okay.
Work that out.
Just on the base employee, it don't raise it that much unless you got the family on it, does it?
So yeah, family would go up $26 a paycheck on the base plan. Yeah, to 160. So right now, the county obviously is contributing towards the bulk of the cost, and with no increase last year in the cost, and with us looking at the increase we're looking at, I think that's why we're looking at seeing a slight increase on these. There could be movement, so you could see somebody say, well, when my costs went up that now, my spouse has family coverage available. She can put the kids on her plan, or you could see some of that. So the enrollment could change, but yeah, that's what the increase would be. They're about $26.85 a paycheck for the base plan.
Yeah, Scott, our county employees said man and wife and got 3 kids. And I'm sure there's some of them that's under the peach care.
Mm-hmm.
Have we got a way of knowing if they got peach care and this type of insurance? I mean,
Not that I'm aware of.
Yeah, most of the time you're not going to be dual enrolled in Peach Care and a employer plan. If someone's eligible for Peach Care, even if say it's a single parent, they would more than likely take single coverage, and if they're married, then they could just take employee and spouse coverage and leave their kids on Peach Care.
I know last year when we was going through this, they give determined, say if you had a husband and wife and the wife was providing insurance through her employer, it was required that she would take out that policy, if not pay a penalty.
That's
How did that work out?
So far, it's worked fine. They have to say whether they could, if their spouse can be provided insurance through their employer. I think it's a $50 charge
Per month.
Yes,
Yeah.
I couldn't remember. It was 50. So
Yeah.
the charge of $50.
Right.
Yeah.
The working spouse rule, correct.
Did we have very many like that? Y'all know of?
Off the top of my head,
I don't know off the top of my head.
yeah, I don't think it was a lot.
It wasn't many.
How
Yeah.
many of those,
Yeah.
that type of, we had?
So most of the time, when you look at the benefits offered by the county, or not most of the time, but oftentimes, you look at that and then what it cost an employee to cover a spouse. Even with that $50, it's better than a lot of employers in the area on the private sector side, because the minimal amount that an employer has to pay is 50%. And you figure if you've got a premium up there and you're having to pay 50% of that, that's going to be cheaper than what it would cost me to cover my spouse here and to pay that $50 surcharge. So that's why
they still come out ahead.
Yeah.
To do that, and there's quite a few private companies that don't even provide health insurance.
Yeah, the majority, well, I won't say the majority, but it's definitely, more common in government to contribute towards dependent coverage than it is on the private sector side. Most employers, private sector, want to pay something towards an employee, but it's expensive. And so when working, in government, generally, the general thought is you might not make as much as you could maybe on the private sector side, but hopefully you make it up a little bit with the benefits, you know.
Okay. And I was just looking on between the difference with the base and the buy-up is, I guess you got one that's like, say it's a base, and the other one is kind of a little bit more elaborate.
Mm-hmm.
The buy-up, which is, really kicks in by the out-of-pocket and the deductibles also, out-of-pocket.
Yeah, it's the out-of-pocket and the RX deductible.
Right.
That's right.
Okay.
And you know, you actually could see employees move from that buy-up to the base. So if someone's on the buy-up and they say, oh, my cost is going to go up, they have that option to drop down.
Right.
Yeah.
Okay.
On new employees, how long they gotta work before the insurance kick in? Is it 6 months, 3 months?
It kicks in the first of the month after 60 days.
Yeah. So the ACA limits, the maximum is 90 days, so that's why the county's waiting period is first of the month following 60. So it'll be a first of the month's effective date. When we look at these, you know, now that the county's self-funded, we don't have a premium that we're paying, so to speak. But what we do have are COBRA rates. If someone leaves here, they're eligible for COBRA. Right now, an employee would pay about $623 a month to keep the coverage if they leave here. So when I leave Ware County, if I want to keep it, I'm going to get a notice, and it's going to say you can keep it, and it's $623 a month. For family on the base plan, it's about $1,900 a month. As it stands today, the county's paying overall about 88% of the employee costs when you compare it to that COBRA rate, and on family it's about just under 85%. So the county is obviously paying the big portion of the employee's cost, and even with these increases, it's still going to be in that 80% range.
Okay. And what was that figure you gave if someone opted out, left the employment?
If someone leaves here, they're eligible for COBRA.
And how much you say that would be from a family?
$1,900 a month.
$1,900 a month for a family.
Correct.
And what about on just a single?
623. Mm-hmm. And that's current. That's the current rates. We'll see what they look like.
And how long would that be till they got to where they reach?
So
better?
COBRA is good for 18 months for a regular termination. All right. So the next slide, slide 5, this is the breakdown of the fixed cost. And as you can see right now, that fixed cost is about $722,000 is where the annual fixed cost for the stop loss coverage is. And we're seeing an increase of about 197 requested on that, or about a 27% increase is where they came in at. We went to market and we asked for quotes from Cigna, United Healthcare, and we went to a independent third party administrator, an independent TPA, and that was Trustmark. And Trustmark came back with a competitive number, and that's how we used that number and went back to Anthem to see if we could negotiate it and push down a little bit, push back on them a little bit, and that's where we came, how we got it down to 876. So it's now looking at a 21% increase on the fixed cost as opposed to that where we were at that 27. Now, while Trustmark is a little bit lower, it's definitely not a year to move. They're right on top of our option 2. If we wanted to do something, I think that would be the only thing that would make sense. So in my recommendation, it would be to either renew with Anthem or to maybe go with option 2 and increase that deductible. And that's what you were talking about earlier, is how I said right now the stop loss deductible is $100,000. It is going, or if we take it to $130,000, it'd be an additional $30,000 on every member. That would actually knock the increase down to just under $6,000 there. But it puts more liability on the county, because then the county's paying all claims up to $130,000 as opposed to $100,000. And so the break-even number there is about five members. If we had 5 members go over that $130,000, then we would have spent more than had we just stayed on $100,000 deductible.
Didn't we have 12 of those?
We have 12 that are over the 25,000 threshold, but as it stands right now, there's only 4 that are over 100.
Is that total for the year, is that? per
So far for the
incident?
year, so far for the year. The plan year ends in June, so we'll have to see how that comes in.
I think he was talking about the mark. Is that a year, weren't you?
Yeah,
It's not
through,
an incident, right? It's for the year.
it's
Total-
for the year,
Total charge.
correct. It's a 12-month period, 12-month contract.
Somebody has to have open heart surgery, you're looking at what, 120, 30, 40?
Yeah, like I said, we've had 4 so far that have been over. You know, it's crazy whenever we look at these reports here and just across the board, you'll see this, but it's not the same people every year. It's, you know, new members show up on the report. But yeah, things happen. You know, cancer is obviously a big one. This year we've seen some COVID claims out there, but yeah, it doesn't take a long time in the hospital to hit that number, any kind of major surgery. All right, makes sense there. All right, slide 6 is talking about the claims projections. Lots of numbers here. If you're looking up top under current, you're going to see that the projected total was just under 2.9 million. The maximum claim liability was just under 3.6 million. The actual is based on how the claims are running through March. And when we look at actual, if the claims were to continue to run out as they have been at the same rate, we would be seeing just under 3.5 million. Or you could look at it as about 20% above the expected number, or about just under 4.5% below the max. So the actual number of 3.4 is right around what we anticipate seeing through the end of June. Now, if the claims, that's why I go back to that first slide when I said claims are running the most recent 2 months, running a little bit better. If we see the trend continue that route, then that number is going to be lower than what we see there. So when you're looking at the bottom, the renewal section, this is based on the contract and what Anthem gives us a number. They say based on what we're seeing and how things have been running, this is what we anticipate the claims to look like next year. And so we're showing if you look at how it's running now, how claims are running now and what we're anticipating, we're looking at about a 16% increase for projected for the year. And if it were the maximum liability is about 45% above what was projected. So that's about 4 million compared to what we're thinking is going to come in somewhere around 3.4 million. And that is that 16% increase. Now, this is where I go back to where I was saying earlier. If you're fully insured, they're going to tell you, here's your new premium. They're going up X amount. Whereas when they sit there and they tell us what our claim liability is looking like, your claims are your claims, and they're going to run, however they're going to run, whether you're fully insured or you're self-funded. But the benefit of being self-funded is when they do run much better, the county reaps their rewards there.
Is there any, let me ask you, is there anything we can do to lower, like, when I had a company, we used to do a lot of programs, would help on our insurance. Mm-hmm. We had safety programs, we had all kind of things, and I'm sure the county already has a lot of it. But is there anything new that's out that we could?
Well, the county does have a wellness program in place. Yeah. And I'll talk about that in a minute, but that's, making sure employees are getting their physicals out there, getting their screenings, and early detection, early prevention of those, checking their blood pressure, cholesterol, trying to prevent those strokes and heart attacks from happening. I mean, like I said, whenever we look at these, the high-cost claimant reports every year, it's different members every year. And, you're going to see cancers, and this year, of course, COVID, and I don't know if there's anything that could have been done to prevent those things. So, I don't want to say it's the nature of the beast, but unfortunately, whenever we look at, accounts and we review the claims, the new members that are showing up every year, it's like, could a wellness program prevented that? Well, maybe, but a lot of it's just really out of our control. But I will say this, when we went to market, we asked Cigna for a quote, we asked United Healthcare for a quote, and then the Trustmark, they were quoting us on the using the Cigna network. Anthem does have the best discounts in this area. That's one of the major reasons why it makes the most sense to stay with Anthem. If we were to change to Trustmark, who quoted, and they're quoting that Cigna network, so basically Cigna lets them use their network, so all the employees would be utilizing the Cigna network if we made that change. Their discounts might be 5 to 10% higher than Anthem. So if your claims are your claims, and you're going to change plans, you're going to go to a network that's not discounted as well as Anthem, well, you're going to end up spending 5 to 10% more just in claims alone. So that's why it makes so much more sense. That's actually why Cigna and United Healthcare declined, because when they looked at everything, they just knew they couldn't compete with the Anthem numbers. So the wellness program here, I don't know if you noticed when we looked at the deductions and what employees pay if they don't participate, but basically they participate here because there's a big enough difference in that. I don't know if there's anything else to add to what I'm saying, but no, the county does have a really good wellness program in place. And actually, if you look at the next slide, these numbers are going to be updated, but last year we kind of tweaked the program a little bit. So employees are required to get a screening, a wellness screening, and required to do the online health assessment. And by doing those, they are then considered a wellness employee. They don't have to pay the extra money. And what that does is we used to do the on-site biometric screenings where an employee would come in and they'd see a nurse and they'd draw their blood and do all the screening. Now they're required to go to their own doctor and get it done. And what it's doing is a lot of people say, I'm healthy, I feel great, I don't ever go to the doctor. Well, we're requiring them to go to the doctor to get this screening. And if there is something, if you do have high blood pressure, high cholesterol, you have accountability. That doctor, if they're doing the job, he's going to say, okay, I need you on this medication. I need to see you in 6 months or whatever it may be. Whereas when you do the on-site biometric screenings, it's like, all right, I'll see you next year at next year's health fair. So that was one of the tweaks to the program. And we've had a lot of participation in that. And the way the program is designed is not only they get the lower cost on their employee deductions, but they also earn gift cards. They get a $50 when they do the screening, and they get a $50 gift card when they do the health risk assessment. And so year to date, we've had just over, or I guess this would have been through February, just over $10,000 in rewards paid back to employees. So the next slide is the dental. We're seeing another trend we're seeing across the board is, dental offices were closed April, May, and June last year. A lot of them were. And so when they reopened, we saw a heavy increase in usage. And so did see the claims increase here a little bit, which is why there's a 5% increase on the dental. The still competitive rate there, but the dental is voluntary. So that's the MetLife dental plan. And you can see what the premium looks like now, where it's going to, and what the employee deductions would go to. So for instance, somebody you got 101 employees paying $16.96 a paycheck would go to $17.81. I'm sorry? Yeah. Oh, my title's wrong. This says employee health and wellness. I apologize. That's dental. So you see MetLife, that's the dental plan with the 5%. Sorry about that. And the next slide is the basic life insurance and group LTD. This is county paid. And again, unfortunately, there were some claims on the life policy this year. And you can see what the county spends annually for the coverage there and what it's going to. We went to market. We went and asked MetLife for a quote in Dearborn National. I think Dearborn was right on top of One America, and MetLife was higher. And so there's no change to the long term, but the life insurance is going up there. Still a competitive number, very competitive number at 20 cents per thousand. The other thing, obviously, that you factor in, it's not always just on cost, but we really do like One America. We've had other carriers out here, and One America does a really good job service-wise. I know HR and employees are very happy with them, so recommending just renewing with them. If you go to the next slide. This is the voluntary life and STD, short-term disability insurance. There is no change on the voluntary life, but there was an increase on the short-term there as well. Kind of give you an idea, an employee that makes $43,000, that's say 30 years old, is paying $17.08 right now. They would go to $20.15 on the short term. And again, that was where we went to market and could not compete with those numbers. So we're recommending to renew with One America on both the life and the short term.
Which
Voluntary
employer
life.
pays 100% of that anyway. don't
That's voluntary. Mhm. All right, and then the next slide 11, this is kind of just tell you where there was no change in the vision plan or the rates. We have open enrollment scheduled for May 17th through the 19th. We got the schedule there when we're going to be here. We'll have MSI representatives will be here to meet with employees. Employees obviously will have the option to go online and enroll as well if they don't want to come in and sit with someone. So a lot of people take advantage of that, but that is the schedule when we're going to be here and where we're going to be. We'll be getting packets to everyone the week before. You guys probably remember they've seen the enrollment, the employee benefits handbooks. Everybody will get a new handbook. We need open enrollment to be completed before June 1st because the county does deduct a month in advance. So we'll be doing it those 3 days and wrapping it up prior to June 1. So based on what our review, management review, and what we've looked at on the market, renewing with Anthem, MetLife, and One America is the recommendation. If you go to the next slide, this kind of summarizes everything here. On the medical, there are 3 options there. The fixed cost, option 1 is to renew at the $100,000 level. Keep the contract basically the same way it is now. Option 1. Option 2 is to increase the stop loss deductible to $130,000. And again, option 3 I don't think is really on the table, but it's listed there to change TPAs. If you're looking at the claim liability, you can see what we have the expected claim liability to go to and the maximum claim liability. Employee deductions, obviously we could keep them the same, but we're making a recommendation to increase those to that number there. Renew the dental with MetLife and renew with One America. And that kind of summarizes everything that we're looking at.
Can we back up to the dental insurance?
Yes, sir.
Okay, like employee and spouse, $70.55 a month.
Mm-hmm.
Times 12, that's about say $50 a year. Your total monthly you can spend at dental is $1,500, right?
All right.
So really, I ain't getting $800 for
That's right.
coverage.
That's right. Yeah. Yeah, dental insurance is one of those things where if you have, good teeth, you go in a couple times a year for a cleaning and that's it. It may not make sense for you to sign up for it. But if you need a root canal or, something major, the thought is I'd rather pay that out of my check pre-taxed and then have it for when I go to the dentist rather than have to come out of my pocket with all that at once. That big root canal, that crown, whatever it is. But it's voluntary, so it's up to the employees. They sign up if they like. They use it. That's why it's going up.
If you get your teeth cleaned twice a year, does that come out of that $1,500? Is that separate?
It does come out of, but the cleaning doesn't cost anything. Yeah. No, you did the math of what I would do a lot of times sitting with an employee. It's like, all right, take that times 12, or take your deduction times 26. This is how much you're paying. This is what you get. Are you going to use that? A lot of employees waive it, so a lot of employees don't take advantage of it. If they're like,
Plus, $2,000 to $3,000 a year.
Yeah. No, that's a good point.
John, you mentioned about when we're talking about Trustmark, which would be another option, I guess, but your recommendation is not go because of going with, even though it might be a little less initially, it's going to end up costing more, you think?
Yes. Well, the funny thing to me is when I have Cigna Direct declining to quote because they say their discounts in this area aren't that great, Yet I got another TPA telling me they're going to use the Cigna network. I'm like, wait a minute, something's not right. And so when I asked Trustmark about that, they said, yeah, you know, their network is not discounted as well as the Anthem network down there. I know, like, for instance, with Humana we didn't go to this year. They never quote down here. It's all about the contracts they have with the hospitals, and I know that they said next year they will be an option. They're going to be they're going to have a better contract with the hospital and have some, you know, maybe be able to compete a little bit better in this area. But it's like when you look at it, if you focus just on the fixed costs and you forget the big number, which is the claims, that's when you can get really messed up and say, wait a minute, I thought we were saving money. Well, you might just saving a little bit over here on the fixed cost, but in the grand scheme of things, you're paying more because of that poorly discounted network.
So your recommendation for option one?
Like I said, I think it's, from a liability standpoint, I think that would be the way to go. If we have, I don't know that we're going to have over five high cost claimants, 5 stop loss claims. I think that the first year renewal for you guys, keeping it at 100,000, I think makes the most sense, and then gradually increasing that after this year. We're moving into, this current year was an immature year because there was a lag in the claims. When we went to self-funded, and the county started paying the claims, any claim that happened prior to June 1 or July 1 was paid under the fully insured side with Anthem. So that claim didn't hit you guys. So you started fresh July 1. But what happens is with the doctors and the hospitals, there's about a 30 to 60 day lag time. When if I go to the doctor today, that bill doesn't show up for Anthem to pay maybe for 30 days. And so that's why it was an immature year. So now we're going into year 2. It's a paid contract where every month is going to be a paid month where there won't be any of that lag time since we're in it now. And so I think that's why it makes sense to keep that stop loss deductible there for this year.
Scott, and I may have missed it, what's the percentage? The county pays a percentage and then the employees pay a percentage.
That's correct, yes.
What's the percentage we pay?
What's it, 88%?
It's 88% when you look at it compared to the cover rate. It's 88.5% for employee only. It's like 85% for family. It's hard, basically Anthem gives us what the cover rate's going to be based on actuarial numbers. But ultimately, because we're self-funded, the county could set that number if we want to, but we let them do it. Their underwriters and actuarials set that number. And because we haven't renewed, we haven't told them what we're going to do for next year. They haven't provided what that COBRA number is going to be for the upcoming plan year. So it's hard to say that what that percentage would be based off the COBRA rates for the new year because we don't have the number. So if we're just looking at current right now, we obviously know there's an increase. So if you figure out what that increase is to the employee, the overall percentage is probably going to remain the same, what the county's contributing, roughly that 88%. When we look at benchmarks, we see what other, I said we have about 60 government clients in Georgia, and obviously have a lot of others that we're friends with and have their information. And when we look at benchmarks, on average, county government for employee only is about 90 to 93%. It's about the average, and anywhere from 55 to 60% on family coverage. So you guys are right there on the employee side and very generous on the family side when you compare it to others.
I believe we need to educate our employees, let them know just how much money the county is
We do.
saving.
Mm-hmm.
We do. When we go through open enrollment, they see it on the screen, be it if they're at home with their spouse or sitting with one of our enrollers, one of our MSI representatives, and then we give them a paper copy afterwards, a total compensation statement, saying, here's what you elected, here's how much the county's paying, here's your salary, and this is what % of your salary is benefits. And they get that statement printed every year after open enrollment. So they see it when they enroll, and then they see it after they're done enrolling. And if they're at home, they can print it. We don't have printers, portable printers when we do the enrollments here.
our staff recommendation?
Same one. We all talked about it on what the recommendation would be, and that's how we look at it too, especially leaving the, stop loss at 100,000 for this year.
Instead of
And then it might be-
130.
Yeah, yep. But, I mean, based on, the information we're getting, it appears that the claims are even starting to drop down in the last couple of months.
Right.
So we're hoping that does, set that new benchmarks. It's all somewhat of a risk anyway. You never know. I mean, you
Yeah.
could have double the amount or you could have half the amount. So, that's exactly what the recommendation is to.
It just so happens we moved to a self-funded contract in a pandemic.
Yeah.
And now, I think we're on the back end of it. And while we've seen a higher claim year than anticipated, we think that a lot of that was due to COVID, and we think it's going to continue to trend better than it has been. So that's why I think did we make the right decision to go self-funded? Absolutely, we did
How
last
many
year.
counties in Georgia do you think are self-funded?
Well, it's going to be generally, your larger accounts. You guys have about, I think, 500 members total under the plan. So you're about, pretty close to being credible. If you're Pierce County, where they have 100 employees, they're not someone who should consider going self-funded. So it's based on your member total. And you guys, because you pay so much of the family costs, you do have a high member total, high premium. But, any large county out there is going to be self-funded. Most everyone with over 500 employees. I can tell you, Anthem says that their overall block in the state of Georgia is over 85% are self-funded. And so, because they have the state, I think that's why their number's that big. But all your larger counties are going to be self-funded, like Savannah, the Savannah area, Chatham County, Glenn County's.
What city Waycross got?
They were self-funded.
They were, didn't they change
Are
it
they?
when we
You know
bought
where?
it a couple years ago?
Yeah, I want to say they're fully
They were
insured now.
self-funded for a long time, and I think
Yeah.
they switched back to fully
Yeah, they may have gone back.
a couple years ago.
Yeah. It's easier to go from fully insured to self-funded than it is to go from self-funded to fully insured. Because what happens is you move, if that ever happens, hopefully, you're moving and you're paying your lag claims that are running in for a couple months, 2-3 months, and you're paying premium on top of it, so.
And you mentioned about the wellness, how that helps, and for the premium and all that. Ms. Bailey, do you have a rough idea as far as vaccinations, as far as the COVID vaccine? A lot of I guess that might get into some kind of HIPAA stuff, about whether you can ascertain that information or not.
Right, so I don't.
We reviewed, I have the report, let's see. Let me see if I have a number at all. I don't think it has vaccines. No. It doesn't give me the total vaccinated. No, I don't have that number. And they gave us a very nice report on it. I know that's something that Anthem's looking at down the road, making a reward for, is getting the vaccine.
Well, just like I think with the flu vaccine, we offer some kind of an incentive, for lack of a better term. And even at our agency, Action Pack, I chair that board there, and we offer employees like a day off, they want to get vaccinated, but that's completely voluntary. It's not mandatory.
Right.
But, just to, but then we have a deadline, as to how long they can do it, before.
Right. Yeah, that's the deadline here for their wellness is April 1st, so same kind of thing.
But one thing I was gonna mention, and John mentioned this, you have nearly $350,000 of COVID claims in this, what we have so far.
Right.
So we're hoping that will start to diminish and go down, so that's definitely a plus there.
Would vaccination be included in that?
I believe so, isn't it?
It would be.
Vaccine.
Anything related to COVID would be.
We said we had 277 claims under the COVID, that's part of shops and everything.
Yep.
I think the kids are good in the shops, aren't they? The doctor's office.
Yeah, but still probably need insurance.
That's-
NSI have that information.
Yeah, I was gonna say, if it's not filed, then Anthem doesn't have it.
Right.
It's only when I give them my card that they show up on this report. So this report is not gonna be completely accurate on that.
You have, any medicines that you get put on if you have it, some people experience much worse symptoms from it. So you have the pharmaceuticals, you have the testing and all that other stuff.
Do we have an incentive for the employees like you told about the?
We don't, no,
don't?
sir.
They're not capable of administering that yet. That's what I'm saying. I think they're
Would
gonna,
it be good that we did?
yeah, it's really on Anthem. Now, if the county did something
I can't
internal,
make them, I don't guess, but
Mhm.
it would might help and cost.
There's quite a few people that's not getting the vaccine.
yeah,
They just,
And the preventative part of it, to keep the claims down, is what's gonna help everybody.
yeah,
That's the bottom line number right there. Everybody working to keep their claims down. Like you said, you can't plan for the unexpected, but if you do your screening and the doctor finds something and he can get you on medication to keep you from having a heart attack or a stroke, then that keeps the claims down.
And that's what the wellness program outlines. Do your screening and do your survey online, which asks you a bunch of lifestyle questions, and it gives you a report at the end of where it assesses your health. It gives you problem areas that you may want to think about, you may want to consult a doctor for. And then the screening, of course, is with your doctor. So if you're walking around with high blood pressure and you don't know it, well, now you're going to this wellness screening and we're getting it under control before it becomes
A big claim.
catastrophic
Yeah.
claim.
And we're still getting the 12 free telehealth
Mhm.
visits for them.
Yep.
Anything else? Anybody?
we'll need to, excuse me, we'll need to get official action by motion and a second, and that way we can move forward. We typically do that as formality anyway, but basically that would be a motion to accept the recommendation of, Mr. Leggett, and then we can we'll start fresh in the morning with all the new stuff to change over, if that's the pleasure of the board.
Okay. Do we have a motion to adopt one of the, which option? Oh,
Yeah,
I make a motion to accept the 2021 benefit renewal that the staff recommended.
That's it.
I'll second that motion.
second. Let's have a vote on it. Let's have a vote on it. Burris,
Aye.
Mr. Barner, Mr. Tanner,
Aye.
chair votes aye.
thank you.
Thank you.
Thank you, John.
That's it. I have a motion to adjourn the meeting.
So move, Mr. Chair.
No, we got some questions. Hold on.
Yeah.
Go
Say
ahead.
that.
Comment.
Somebody had a comment?
Yeah, you got any?
No, I was just offering a motion. I didn't know if somebody else had a
Did you?
I'd just like to say to the employees, county offers this benefit to you, you just think of it as part of your salary. Whenever you come onto the county, or hire onto the county.
Yeah, pretty good plan, eh?
And also, Mr. Chair, if I may, appreciate the presentation by, John and his associate, Mr. Earl, and also to our staff, the one that worked on this, because I think they're looking out for what's in the best interest of the employees, and to just piggyback on what Commissioner Barner said, I think the employees really should consider themselves, blessed to have a good plan like this, because even though you may not be getting the money, you're saving it in benefits throughout the year. And, we all know that that's pretty much the norm in any industry right now is healthcare. So, appreciate Ms. Bailey and her staff and everyone else that, participated in Beverly for crunching the numbers and, giving what's best for our employees. That's all.
You can take it out, anybody? I wanna thank you, John, for coming and presenting it to us. You did a good job. I hear a motion to adjourn the meeting.
Motion to adjourn.
Second.
Vote. Mr. Tanner,
Aye.
Mr. Barner,
Aye.
Mr. Burris.
Aye.
Chair votes aye. Be adjourned.